Good morning,
Good
Julia.
morning. I want to talk about boosters, which is a very big issue this morning. But first up, let's talk about this announcement, as was long expected, that we would have mandatory jabs for frontline NHS staff. Do you think that's the right move?
To be honest, I'm never very keen or happy about compulsory vaccination. I would rather the professionals who are on the front line decide to get vaccinated themselves. And to be honest, I don't quite understand why people are not being vaccinated who work with patients, because it is a professional necessity, essentially.
Well, indeed, we know that 90% of NHS staff have already been double jabbed anyway. This doesn't come in until next spring. Now, of course, the care workers, that starts on Thursday. So tomorrow is the last day when someone who's not double jabbed can work in the care sector. They will be losing their jobs, and it's thought a few tens of thousands will indeed be losing their jobs. They can, though, go straight over to get a job in the NHS where they will be allowed to work. Now, the NHS has been given that many months' notice, partly because that was the same amount of notice that care workers got, but also because there are so many fears that too many staff not being double jabbed, not being available to work, will create even more problems for the NHS in terms of shortages. So is this a sort of a weighing up of the risks in terms of not having double jabbed staff, but also not having those staff at all?
Well, I think, yes, I think this is the law of unintended consequences. You make a rule to lessen the chance of COVID spreading within a hospital, but if you end up causing an exodus of staff over the next 2 or 3 months, then actually it will be a significant burden for the NHS, because we're already stretched. So even 5 or 10% people leaving from the front line would be a disaster, essentially.
Well, there's a lot of people that are concerned that mandatory jabs actually, it sort of basically fuels the conspiracy theories. It doesn't engender trust in the health system. And actually sitting down with the people who've not been jabbed and giving the statistics and giving, and talking it through with them is often a much more effective way of making sure people do get the protection of the double jab.
Well, yes. And I'll be very happy to speak to health staff who work on the front line who've not been vaccinated, try and work out and try and allay their fears. So that would be a good thing to do. You would have thought that if there are nursing and maybe even doctors who are not being vaccinated, they would understand the situation and would be able to. It shouldn't really be necessary. What you're asking about is what's necessary for the 5 million people thereabouts across the rest of the country of not being vaccinated. And that's really difficult to achieve, just to numbers and knowing who they are.
And that's the thing, isn't it? Well, looking at the stats, it particularly looks like it's poorer people in urban areas and much more likely to be people of ethnic minorities as well. So that is a serious concern, because we have seen, certainly particularly ethnic minorities, latest statistics showing, particularly for Asian people of South Asian heritage, they can be at higher risk of dying once getting COVID because of a certain genetic differences. But let's talk about the booster, because there's been a lot of focus on getting those boosters out. Everyone over 50 is eligible for their booster now, reducing the amount of time people have to wait to get those boosters. But there is still some concern that not enough people who are at risk will be able to get their boosters in time for Christmas. Should the booster rollout have started sooner?
That's an interesting question. I think the data for the necessity for the booster program wasn't all that clear until we made our decision. It has to be said. It's, as always with the vaccination program for the COVID-19, we've been working on the very edge of the data at the time, making decisions as soon as we can, essentially. So the problem initially of the booster campaign, I think, was the fact that there were different vaccination programs going on simultaneously. There's the vaccination of children, which we have discussed before, and there was the vaccination of the immunosuppressed for their third dose, and then the booster jab as well. So there's a sort of a spreading of the vaccine delivery arms in different directions, and that, I think, made things more slow than we hoped.
Is that a diplomatic way of saying, if we had just focused on getting booster jabs into the elderly and most vulnerable as soon as possible, and focusing on getting to the 4 or 5 million people who are not vaccinated, who do need those jabs, that actually that would have been a better use of NHS resources than trying to put jabs into 12 to 15-year-olds?
I'm not going to answer that one. I think.
Shall we deduce from that is the case?
I don't think. I'm not saying that. I'm saying.
But shouldn't we be focused on protecting the people who are vulnerable as opposed to the people who aren't vulnerable? That would make sense medically, wouldn't it?
Yeah, it comes back to the point I made a minute or so ago about timing of of decisions and data. So, those decisions you're talking about, they all came at separate times, and they ended up arriving as delivery at about the same time. So I think it's not fair to say that that is the situation, because the timing of the decisions was such that the children came much earlier, and then so on and so on. So it's yeah.
It's complicated. I realise that you're very much a medic who has to sort of, in a way, has ended up sort of straying into politics in the sense that the COVID jabs have become political. But I can feel your discomfort. So let me ask you about vaccine immunity, though, because there's no doubt at all. The stats are very, very, very clear. There's a lot of very misleading pretend stats that are often out, and sometimes deliberate misreading, I think, of stats. It's very clear that if you are double jabbed, you have a much, much, much higher chance of not getting seriously ill and not ending up in hospital and not dying. It is very, very, very clear. However, there's concern about the waning of these jabs, and we saw that in Israel, their statistics, which is why we're having the booster jabs for the vulnerable and the elderly who had their jabs much sooner, and it's why that's being rolled out. Well, the former Vaccines Minister, now Education Secretary Nadeem Sahawi, has suggested that the UK is aiming to have an annual booster programme. Is that something that you think will be necessary?
Yeah, I think the lesson of the past few months is that the vaccines are very effective, but the efficacy wears off after a while as the antibody levels slowly sink down, which is a natural thing after your vaccine dose for it to go. The antibody levels will slowly sink down, and then the chance of getting severe infection goes up, and it hasn't gone up by much. So you're probably 95% protected after 2 doses against very severe infection ending up in hospital. After about 6 months, that might fall to 90-ish%. It depends on who you are and which vaccine, and so roughly a 5% fall. However, that doubles the number of people who may end up in hospital as a consequence, even though they've been vaccinated. So that's why the booster jab is necessary. Now, what we don't know is once you've had 3 doses, is how fast that antibody effect will wane, whether you need a booster jab in a year or 2 years or 3 years. It's quite likely to be much more prolonged than after 2 doses. The amount of antibody you get after 3 doses is higher, and the waning is probably going to be a little bit slower. So we would hope that the need for a booster jab won't be in 6 months' time, but it might be there in 12 months, but it may not be. It might be 2 years. We just have to see the data. And coming back to the point I made before, we will make those decisions when we have the data, which will be, in a few months' time, essentially.
Okay, really good to talk to you. Professor Jeremy Brown, he's a professor of respiratory infection and a member of the Joint Committee on Vaccination and Immunisation.